Since 2015, Middlesex Health has been part of the Mayo Clinic Care Network, which helps healthcare organizations across the world improve their care.
Yeah, and Megan Yost recently sat down with the CEO of Middlesex Health and the medical director of Mayo Clinic's Provider Relations to talk all about the program.
Joining me now is Vincent Capice from Middlesex Health and Dr. Mark Larson from Mayo Clinic. Now, Dr. Larson, tell me, what is the Mayo Clinic Care Network?
The Mayo Clinic Care Network is a collection of over 40 domestic and international healthcare sites. These are high-quality organizations that have chosen to make an investment in their community and the care of their patients by working with the Mayo Clinic in clinical collaboration, which we feel benefits their patients.
Now, Vin, why did Middlesex Health want to join the network?
Because we want to advance healthcare in our community, and we want to collaborate with some of the highest performing organizations in the world. And arguably, the Mayo Clinic is, the best healthcare organization in the world, and so we sought to work with the best, and that was our goal.
Dr. Larson, how does the network work?
Well, the Mayo Clinic Network is not a ownership model. It's not a partnership. It's rather a contractual, owned relationship with the Middlesex Hospital and Middlesex Health, and its basis is really on clinical collaboration.
Vin, let's talk about how the network benefits patients here at Middlesex Health. Let's start with e-consults. Tell me what that is.
Sure. So an e-consult is a way for a patient to request that their case be reviewed by a specialist at the Mayo, or it could be initiated by a physician who's dealing with a particularly difficult diagnosis, and they want to bounce something off of another physician, which often happens. And our physicians, because we have this collaboration with the Mayo, have 4,000 specialists at the Mayo Clinic that they can collaborate with. And so using an electronic portal, we send clinical information safe and securely to the Mayo Clinic. It's assigned to a specialist. The specialist reviews that information and provides a report back to the physician within a few days.
Great. And also e-boards. What are e-boards?
So a tumor board is something that's practiced in pretty much all cancer centers throughout the country. And it's a meeting that occurs where physicians from many different disciplines get around the table and talk about some of the most difficult cancer cases. And so we've been doing that, in many organizations around the world have been doing that for a long time. What our collaboration with the Mayo allows us to do is to participate in their tumor board meetings and to get insight and input from their specialists.
Now, what's in store for the future of Mayo Clinic and Middlesex Health?
It's been a fantastic 3.5 years so far. Middlesex has been a very engaged, very active member of the Care Network. I think they're probably the poster child for level of engagement, for pushing the envelope on trying to further efforts to improve the care of patients locally, do everything in their power to utilize best practices, evidence-based medicine. And this, from our end, this has been a really exciting relationship.
I think that we've only begun to scratch the surface, and I think most of our efforts have been focused on clinical collaborations, but I can foresee a time when this moves into perhaps the business end of things. We also are looking at how we can use this collaborative from a political perspective. So a couple of years ago, the Mayo started having meetings of CEOs from Care Member Network participants in Washington to educate Congress about what we're doing. And I think this is an example of the industry, the hospital industry, trying to work together to address issues that we all have in common, to lower costs and to increase quality. I think that's one of the areas where we can see, or I can see us expanding our efforts together.
Excellent. To learn more about Middlesex Health, you can of course visit middlesexhealth.org. Thank you both for talking to me today.
My pleasure. Thank you.
Thank you.